Mr. President, I wanted to address the issue of health care reform, of course, which is the main reason that Congress is here this weekend and how it was here last weekend and in all likelihood will be here next weekend. But I also think that it's important that we put these things into overall context and take a look at the bill that we are voting on right now. We're going to have a final vote on final passage tomorrow. We had a cloture vote this morning on a spending bill. And the spending bill, which represents six, I think, appropriation bills that didn't get done earlier this year, represents a package of spending that overall increases by 12% over last year. Now, that's an interesting, I think, number given the fact that the Consumer Price Index, which is the sort of, if you will, conduit to which a lot of these decisions are made around here, is tied. In other words, the CPI is what we view to be inflation. And sometimes when we say we mark bills up at inflation or inflation plus this or inflation plus that, where the CPI is, ending in September or October 1 of this year, was about 2/10, or I should say 2/10 of 1%, but in the negative column. And so you've got a CPI that's actually negative, an inflation index that's actually negative for most Americans. And this is the representative, I think, of the totality of our economy and what things cost, and that's a lot of times how appropriation bills are measured. So you've got a CPI, a Consumer Price Index, that is running in the negative, and yet you have appropriation bills, this one being representing, again, as I said earlier, six appropriation bills, individual bills that didn't get done earlier, packaged into one big spending bill. That's a 12% increase over the previous year. Now, how, Mr. President, can we go to the American people and justify year-over-year spending increases that are 12% when they're having to balance their budgets and tighten their belts and live in an economy, some people losing their jobs, but certainly everybody struggling to survive out there. And that's true for small businesses, that's true for families, that's true for, I think, pretty much everybody, it seems like, except the United States Congress. Here in Washington, D.C., we seem not to be listening to what's happening in America, because marking spending bills up at 12% over last year's level, at a time when the CPI is actually running in the negative, when you got negative cost of living increase, and yet we are marking up appropriation bills that represent a 12% increase over last year's spending level, and you put that on top of a stimulus bill that passed earlier this year that with interest is a $1 trillion spending bill. So you have a $1 trillion spending bill with interest passed earlier this year, much of which went to the very same federal agencies that are going to benefit from this 12% increase over last year in annual appropriations. So you put a $1 trillion stimulus bill, you look at appropriation bills, and again, this being representative of most of the bills this year, the year-over-year increase at 12%. At a time when most Americans are having to tighten their belts. Now, we hear that. We also hear that the TARP program is now going to be used as a slush fund, so to speak, to pay for all kinds of other government spending. In other words, they have decided, at least, I think the administration has, to use the TARP fund as sort of a pay-for lots of things that they want to do. Now, most of us know that the TARP fund was created specifically to stabilize our financial markets, to prevent what we thought at the time was going to be an imminent financial collapse. That purpose has been served. I have a bill that would end the TARP program at the end of this year, on December 31st. If it's not, when it's set to expire at the end of this year, if it isn't allowed to expire, if it's extended, it goes in well into next year and can be used, as I said, for all these other things that politicians have designs on doing. And so my legislation would end it at December 31st of this year, as was intended, and make sure that any funds that are paid back in from loans that have been made or assets that have been acquired actually go back to the Treasury to pay down the federal debt. Because that is, Mr. President, what, in fact, the TARP program was intended to do. Once the job was accomplished, it wasn't to become a grab bag and found money for Congress to use for all these other things. And so you've got the TARP fund now morphing and evolving into this sort of political slush fund to be used for all these other spending priorities. You have this $1 trillion stimulus bill out there. You have this appropriation bill at 12% year-over-year increase over last year's level. And on top of all that, we pile a $2.5 trillion expansion of the federal government in Washington to pay for a new entitlement program with the health care reform bill that is being debated in the Senate in the last week and in the week to come. And so at some point you have to say, and I think the American people look at us and say, enough already. And I think that's what they're saying. I think the reason that we're seeing these public opinion polls that are turning a thumbs down on this massive expansion of the federal government here in Washington to fund health care is because the American public is becoming increasingly uncomfortable with the idea that the federal government continues to run the credit card up. The stimulus money was all borrowed money. The TARP money is borrowed money. The appropriation bills, for the most part this year, or for a large part at least, is borrowed money. 43 cents out of every dollar, Mr. President, that the Congress will spend, or it spent last year, I should say, in the last year, which fiscal year ended September 30th, was borrowed money. We continue to borrow and borrow and borrow and pass on the debt to future generations. We cannot continue to do that and expect to have a future that enjoys the same level of prosperity and the same level of economic growth and vitality that we've experienced in the past. You cannot continue to pile up these massive amounts of debt. The federal debt, Mr. President, is going to double in 5 years. It's going to triple in 10 if we continue on this current path. And right now, I don't see anything that's going to put any brakes on this. The capacity and the appetite and the willingness and the inclination of Washington, D.C. and politicians here to continue to spend and spend and spend seems to be unlimited. At some point, we've got to put the brakes on. We have people who have a foot on the pedal. You got the Democrat majority in the House of Representatives, the Democrat majority here in the Senate, the White House, all have their foots on the accelerator. Somebody has to put on the brake. And that's what we're trying to do. That's why I think it's important that we end the TARP program before it gets misused and spent for all these other things. And why it's important that we rein in these appropriation bills. We're doing everything we can to stop this appropriation bill from being passed at 12% increase over last year's level. And we're doing everything we can, Mr. President, I would say, to stop this massive expansion, $2.5 trillion expansion of the federal government to fund the new health care entitlement at a time when we have all these other debt problems and deficits and as far as the eye can see. And so I wanted to, in shifting gears, I want to paint that sort of as the context against which this whole healthcare debate is occurring. But I wanted to shift, if I could, to some of the more recent developments with regard to the debate over healthcare. I think there are a couple of things that, to me, are game changers in terms of this debate. Now, one of those, of course, is the study that came out yesterday from the CMS, or the Center for Medicare Services, actuary, that points out that the health care reform bill that's currently before the Senate will not drive health care costs down, will in fact increase health care costs by $234 billion. And that today, about 1/6 of every dollar that we spend in this country is spent on health care, that 10 years from now, in 2019, that will be almost 21%. That's what the CMS actuary said, that the total amount that we spend on health care in this country, which today is about 17%, 10 years from now will be almost 21%. So the amount spent on health care as a percentage of our gross domestic product goes dramatically up, not down. And $234 billion is what the CMS actuary said health care costs would go up by in the next 10 years. And of course, we had previously the CBO essentially saying the same thing. The Congressional Budget Office, for those who live outside of Washington, is sort of what the nonpartisan estimator, if you will, of what a lot of these federal programs are going to cost. The Congressional Budget Office said that under the bill put forward by the Senate majority here, the Democrat leadership in the Senate, you would actually increase health care spending by $160 billion over the next 10 years, again, bending the health care cost curve up, not down. And so now you have the experts, the Congressional Budget Office, the Center for Medicare Services actuary, all saying health care costs are going to go up, not down, and significantly up. You have these small business organizations out there saying, the National Federation of Independent Business, the Chamber of Commerce, the National Association of Wholesaler and Distributors, and I might add there's another group that's been formed called the Small Business Coalition for Affordable Health Care, which represents 50 different business organizations, all saying that this health care reform bill will increase the cost of doing business in this country and will drive health care costs up. And so they've come out in opposition to it, as have all the other business organizations I just mentioned, for the same reason. They realize that health care reform ought to be about getting their costs down and their ability to create jobs. And by the way, 2/3 to 3/4 of all the jobs in our economy are created by small businesses. So what are we going to do to small businesses? Pile on a whole bunch of new taxes to pay for this expansion, this $2.5 trillion expansion of the federal government in the form of this new health care entitlement, all for what? So that they can see their health care costs continue to go up. So you pile the new taxes, you cut Medicare to all the providers out there, and I want to draw them into this too, because not only have the small businesses said this is going to drive health care costs up, and they've come out opposed to it. Not only has the Congressional Budget Office says that, not only has the Center for Medicare Services actuary said that, you've got academics saying that, but now you also have the providers saying that. Hospitals, physicians groups are coming out and saying this latest proposal by the Democrat majority to expand Medicare will put hospitals out of business because hospitals get under-reimbursed by Medicare, and so do physicians. And so what do? They shift costs over to the private payers, which is everybody else in this country, and everybody else sees their premiums go up. And so it shrinks the number of private payers, expands the number of government payers, and for those hospitals in places like South Dakota, and I see my colleague from Wyoming on the floor, who are very dependent upon Medicare, they're going to see less and less reimbursement coming into their facilities, which doesn't cover their costs, and very soon you'll have a lot of hospitals, particularly in rural areas, going out of business. And that's been stated. The chairman of the Senate Budget Committee, Senator Conrad from North Dakota, came out and said that basically this latest proposal would bankrupt a lot of the hospitals in his state. I think that's true for a lot of states, and particularly states in rural areas like mine in South Dakota and the senator from Wyoming. So you have the providers saying this is really a bad deal. You have the small businesses saying we can't sustain these increases. We think this is a really bad deal. You've got the experts, the analysts, the Congressional Budget Office and Center for Medicare Services saying this increases costs for health care in this country. And now, Mr. President, you have the American people weighing in and saying, we think this is a bad deal, we think it's going to increase our health care costs. The CNN poll that came out 2 days ago said 61% of Americans oppose the health care reform bill that's pending right now in the United States Senate. Other polls show similar results. And so you have a very sizable majority of the American people who have now weighed in and said this is a bad deal because it cuts Medicare, it raises taxes, and at the end of the day, it raises premiums. So who's for this? Who thinks this is a good thing? Well, apparently, a number of Democrats here in the United States Senate, but that's an increasingly shrinking universe of people. The American people have said it's a bad deal. The experts say it's a bad deal. Small businesses say it's a bad deal. Providers say it's a bad deal. What's left? Well, I'm hoping that there are a couple of courageous Democrats who are going to step forward, agree with the American people, say we are listening to the American people. We are listening to the experts. We are listening to small businesses that create 2/3 to 3/4 of the jobs in our economy. And we agree we are going to stop this train wreck from happening. Sit down, start over, do this right, work with Republicans to write a bill that actually does constrain costs, that drives the cost curve down, and provides access to more Americans. Mr. President, I hope that there are a few Democrats out there who will do that. Because I think on our side, we've concluded, based on what we hear from the American people, what we hear from the experts, what we hear from the business community, what we hear from the provider community, the hospitals and the physicians, that this is a really bad deal. Because at the end of the day, after all this new spending, after all the new taxes, after all the Medicare cuts, what are you left with? What everybody says they want out of health care reform is something that lowers costs. I have our colleagues on the other side come down here repeatedly and say, we've got to do something about the cost of health care. People in this country are struggling with health care costs. Absolutely. We could not agree more. And what they will do with this bill, if it passes, is make matters worse, not better, by increasing costs for most Americans. And I want to show you exactly what I mean If you are a family of 4, and this is again according to the Congressional Budget Office, which looked at this and analyzed these bills and said if you're in the small group market or in the large group market, you're going to see year-over-year increases in your health care costs that are about somewhere between 5.5% or 6%, which is what we are seeing today. And by the way, that's twice the rate of inflation historically. But 5 to 6% increase in your health care premiums. If you're in the individual marketplace, you're going to see your premiums go up anywhere from 10 to 13% beyond that. So if you're in the individual market, it gets much worse. But if you're in the small group or large group market, here's what it says. That if you are a family of 4 today, and you're receiving your insurance through your employer, and they're getting their insurance in the large group market, you're paying about $14,000 a year, if that's what you're paying today. In 2016, 7 years from now, you're going to be paying over $20,000 a year for health insurance coverage. And so your health insurance coverage is going to go up under this bill, not down, according to the Congressional Budget Office. And it's going to go up at a rate that's double the rate of inflation. And again, this is for people who get their insurance in the large and small group market. The yellow line represents the large group market, the red line represents the small group market, but the result's the same. It's an upward trajectory, it's a spike up in the cost of health insurance for people who get their coverage in health insurance in one of those two markets. And again, as I said before, if you're in the individual marketplace, you could spike this thing like this because their costs are going to be 10 to 13% above and beyond what you're seeing here in the large group market. That, Mr. President, according to the Congressional Budget Office. So 90% of Americans, according to the Congressional Budget Office, are going to see their health insurance premiums stay the same, and by the stay the same, I mean go up by twice the rate of inflation, but in other words, locking in the status quo, or worse yet, if you're in the individual marketplace, going up 10 to 13%. And so all this talk about lowering the cost of health care and not settling for the status quo it may sound good, it's great rhetoric, but it is absolutely, factually inaccurate. And so our colleagues that come down here day after day talking about how this health care reform bill is going to drive down the cost of health care are not listening. They're not listening to the American people. They're not listening to the experts. They're not listening to the small business community. They're not listening to the provider community. And I have to say, even the academic community has weighed in on this particular issue, Mr. President, as well. And I want to read for you something that was said here recently by the Dean of the Harvard Medical School. Speeches and news reports can lead you to believe that proposed congressional legislation would tackle the problems of cost, access, and quality, but that's not true. The overall effort will fail to qualify as reform. I find near unanimity of opinion that whatever its shape, the final legislation that will emerge from Congress will markedly accelerate national health care spending rather than restrain it. This will make an eventual solution even more difficult. That from the Dean of the Harvard Medical School. And so, Mr. President, I hope that before this debate concludes, and the push is to get it done by the end of the year. I'm not sure why. It seems to me at least that this is not something you want to hurry. We're talking about reordering or restructuring 1/6 of the American economy. As I said, it represents today 17% of our GDP. We spend about $2.5 trillion a year on health care. We ought to get this right. But there is an intent on the other side to jam this through sometime next week. Well, I hope that we can put the brakes on this. And I hope there are a couple of courageous Democrats, at least one, but two would be better, maybe even more, who will step forward and say, we are going to listen to the American people. We are going to listen to the providers out there, the hospitals and physicians. We are going to listen to the experts. We are going to listen to the small business community that creates the jobs. And we are not going to blindly follow the leader and take this country over the cliff when it comes to health care delivery and when it comes to our economy. And the one final point I'll make, Mr. President, about that, because I thought this was a remarkable finding by the CMS in their study, but they essentially said that the savings that are proposed in Medicare, the new federal spending that relies on Medicare cuts, which are unlikely to be sustainable on a permanent basis. We all over here agree with that. The appetite for the Congress, the willingness for the Congress to cut reimbursements to hospitals and to nursing homes and to home health agencies and to hospices, I find very suspect. And so at the end of the day, if you cannot sustain those, and let's say, for example, for a minute that you can, let's say that these Medicare cuts take effect. If they take effect, and if the Democrats have their way and they expand Medicare, you're going to put more and more people onto a sinking ship because you've got a program that's going to be bankrupt in 2017, we're told by the actuaries. You're going to cut $1 trillion out of it over the 10 years when it's fully implemented, and you're going to put more people onto it. And so Medicare, Mr. President, if those cuts occur, you're going to have more and more hospitals going out of business because they flat aren't going to be able to make ends meet. And so and that's the other thing, by the way, that the CMS actuary found in their study. But they said they don't believe that you can sustain these Medicare cuts on a permanent basis, meaning what? Meaning that the cost of this program, $2.5 trillion over 10 years, is going to fall on the backs of future generations because it will be borrowed. It will be added to the debt, which is growing at $1 trillion a year. As I said earlier, we're going to have a vote, if you can believe that, here in the very near future to actually raise the debt ceiling by $2 trillion over and above what it is today, which is $12 trillion. I mean, this debt situation is probably the most serious crisis and challenge facing this country going forward. And it just seems like there is an endless, limitless appetite for spending and borrowing around here. And at some point, the chickens come home to roost and the bills have to be paid, Mr. President. You can't continue to sustain the level of borrowing. And if these Medicare cuts are unsustainable, which is what the CMS actuary says, that means that a lot of the cost of this new program is going to be financed partly by tax increases, which, as I said, are harmful to small businesses, but secondly, by more and more borrowing, more and more debt, more and more future generations, younger Americans being faced with a massive amount, a massive inheritance of federal debt because we weren't willing to make the hard choices and to be able to live within our means. And so, Mr. President, I hope that when it's all said and done, there will be some people who will step forward, have the courage not to blindly follow the leader, but to say with the American people, with the experts, with the small business community, with the provider community, with even some of the academic community, this does nothing to constrain or lower health care costs. The emperor has no clothes. And if they do that, Mr. President, we can sit down. We're not here for a minute to suggest that we shouldn't have health care reform. All we're here to suggest is it ought to be done in the right way. It ought to be done on a bipartisan basis. And it ought to be done in a way that actually bends the cost curve down rather than raise it, and not cost us $2.5 trillion financed with cuts to Medicare, which is going to impact a lot of seniors, tax increases, which is going to crush small businesses, or debt, which is going to punish future generations. That's what this debate is about. It is a consequential debate for America's future. The stakes are very high. I hope the American people will be engaged in it, and I hope again, Mr. President, that we'll be able to find some bipartisan support for defeating this really bad idea and moving and pivoting to something that actually will make a difference, that will restrain costs, and that will provide health insurance reform that is meaningful reform and that doesn't bankrupt us, doesn't bankrupt hospitals, doesn't bankrupt future generations, doesn't cost us jobs by putting new taxes on small businesses, and actually bends the cost curve down. Mr. President, I yield the floor.